Dear colleagues, thank you for the opportunity to present my work to you. My name is Andriichuk, and a year ago I became a Master of Clinical Psychology, and now I work as a clinical psychologist at the Kyiv Psychiatric Hospital. I mainly deal with diagnosis and neurocorrection of neurodivergent children, most of whom have autism. Every week I meet from 10 to 20 parents whose children are diagnosed with autism. Despite such a large number of children with this diagnosis, there is a huge lack of support and psychological help for their parents in Ukraine, which worries me a lot because their anxiety and depression symptoms, despair and burnout are visible to the naked eye. Many of them feel isolated due to misunderstanding and rejection by society, constant stress to the complicated care of children, and because of the environment which is unsuitable for autistic children. The war, of course, puts even more and more stress on the already difficult lives of these parents. Forced displacement, loss of the main source of income, heavy shellings, all these factors worsen the condition of both parents and their autistic children. Therefore, I decided to conduct a study aimed to measure and compare level of psychological distress in parents of autistic children and in parents of neurotypical children, to determine how strongly the consequences of war affected this category of parents and with which kinds of difficulties they faced the most, and to create foundation for developing adequate methods for psychological supports for parents of autistic children. I'm planning to involve in the research 150 parents of autistic children, both with and without mental retardation, aged from 3 to 12 years old, and 150 parents of neurotypical children, also aged from 3 to 12 years old. For research methods I've chosen brief symptom inventory. It's a great instrument to screen for global psychological distress, and personal information form, which includes information about age, gender of parents and their children, children diagnosis, and also information about traumatic experience in the context of war, about different changes in children conditions due to traumatic events. I'm planning to do descriptive and correlation research based on the received data, and also regression analysis if correlation values will be strong enough to talk about dependence between variables. And of course, I have some hypotheses. I think that psychological distress level will be higher in autistic children parents, and the highest levels of psychological distress will show autistic children parents who experienced a lot of traumatic events related to the war. And also I think that this study will measure how often parents faced temporary worsening of their children's condition in cognitive, behavioral, or emotional spheres due to the stress events caused by the war. In conclusion, I want to say that I strongly believe that this study will help to develop support methods for this group of parents, spread knowledge about autism, and develop an autism-friendly environment. So thank you for your attention, and I would be pleased to respond to any of your questions.